These are all patient counseling tips that you can use for somebody who might be experiencing insomnia. So to limit daytime naps, we need to have them to only be 30 minutes or shorter and earlier in the day, not right before bedtime. Next, we need to avoid stimulants. So this means caffeinated beverages or like the ADHD medications, especially closer to bedtime. Exercise is really important. It has two great benefits. First of all, it tires the body out so that it needs to fall. It feels more likely to fall asleep at night. And second, exercise that doesn't increase the heart rate, so yoga, stretching, breathing techniques, those can all help relax the body right before bedtime, as long as the heart rate doesn't increase. Then natural lighting. Again, this has two sides to it. First of all is exposure to morning sunlight. So if somebody's having issues with insomnia, if they go out right when the sun rises and get sunlight exposure to their eyes for at least 10 minutes, then that can really help to set their circadian rhythm, their clock, get it set in the right way so that their body knows that it's falling asleep time 12 hours later. That right now, this is wake time. This bright blue light is wake time. The other side of lighting is our phones. So our phones, our computer screens, our tablets, they all can emit blue lighting. Like I said, that's sunrise lighting. We don't want to be telling our brain through the blue light that it's awaking time when we're doing computer work or Facebook or checking email right before bed. Because not only does that stimulate our emotional work ethic, but it also affects the blue light stimulation in our brain. And there's an option on phones these days to turn off the blue light at a certain time. So I suggest all of you do that and tell your patients to do that as well. Next is a pleasant sleep environment. So turning down the temperature to as cool as you can tolerate, only using the room for two purposes, as they said in pharmacy school, sleep and sex, and to have it cool, and then if it's not dark, wear an eye mask. If it's not quiet, turn on a sound machine. There are lots of free sound machine apps, so making it as pleasant as possible. Then, we already talked about screen time. Finally, deep breathing. So back to the heart rate. It's important to have a slowed heart rate to be able to fall asleep. So you can tell your patients to do this technique that a sleep doctor recommended. It's called the 4-6-7 technique. So they breathe in on 4, so in 2, 3, 4, and then hold it for 6 counts, 4, 5, 6, and then out 2, 3, 4, 5, 6, 7. And by doing that, it's slowing the respiratory rate, which forces the heart rate to slow as well. That allows them to fall asleep more restfully.